Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. So today we are going to discuss about the conducting system of the heart. Now here in the first slide, the brief picture showing all the conductive system of the heart. And the conductive system is nothing but a series of specialized cardiac muscle cells. These muscle cells, they are specialized cardiac muscle cells which are more sensitive and produce and different in shape from other cardiac muscle cells. So here are the salient features shown here about the conductive system. The first point is that sinoatrial node, SA node. This is the pacemaker of the heart. Pacemaker means that the first impulse generated from here, from this SA node, and then that impulse is transmitted to the whole of the heart, that the atria, first the atria, then the ventricles. And it generates impulses at the rate of 70 to 80 impulses per minute when the atria contract. When the atria contract, then there is a internodal pathway. One of that pathway transmits the impulse to the atrioventricular node, AV node. Here is the delay of the impulse of 0.1 second at the AV node. So the ventricles, they gain the time to fill up from the blood coming from atria during this pause period of 0.1 second. Then from this atrioventricular bundle node, the atrioventricular bundle that arises and that goes towards the ventricles and passes through the interventricular septum, divides into two branches, that the AV bundle branches. One is on the left side, left bundle branch. One is on the right side, right bundle branch. Then these branches, they move to the respective ventricles, left one to the left ventricle and right one to the right ventricle, and then they divide further and they reaches up to the Purkinje fiber, which are connected to the muscle cell of the ventricles. Both ventricles, then they start beating at the apex and then they move upwards. From the apex moves upward. So it is the apex part which is first stimulated, then it runs superiorly and sequentially the whole ventricle contracts. So this was the whole brief introduction. Now what we want to know, conductive system of the heart consists of sinoatrial node, SA node, internodal pathway, atrial pathway, then atrioventricular node, then bundle of phase, and then the Purkinje fiber. So we will discuss these 5 things in the next discussion. Now, first of all, the SA node. It's a specialized cardiac muscle tissue located at the right atrium near the entrance of superior vena cava. Here is entrance of superior vena cava, and here also will be the upper part of the sulcus terminalis. So the pulse, it is a pulse generating tissue responsible for the sinus rhythm of a heart, that is 70 to 80 beats per minute. These are the specialized cardiomyocytes. These cells, they comprise cardiac muscle, contain 1, 2 or very rarely 3 to 4 nuclei. So in these SA node cells, there are 1, 2 or 3 to 4 nuclei. These SA nodes were first described by Arthur Keith and Martin Flack in 1907. So here we see SA node located at the entrance of superior vena cava into the right atrium, and here will be the upper part of the sulcus terminalis. And is a groove here, epicardial groove, and then it is dividing 3 branches going towards the one of them is moving towards the AV node. So then the atria first stimulated, then through this the both bundle of phase, then left and right bundle branches, and then the ventricles. So there are 3 internodal pathways moving towards the then ultimately it moves toward the AV node. These are the internodal pathways which moves toward 3 internodal pathways. So SA node is supplied by, here is the SA node you can see, and this node is supplied by a branch from the right coronary artery. So in 60% of the people, the SA node is supplied by the right coronary artery, but in 40% it can come from the left coronary artery also. And this SA node is stimulated by the sympathetic division of autonomic nervous system, and that is the sympathetic and parasympathetic. The sympathetic will accelerate the heart rate, and parasympathetic will decrease the heart rate. Now is the atrioventricular node. First of all, its location just beneath the endocardium on the right side of the lower part of the interatrial septum. So here we see interatrial septum. On the right side of this interatrial septum, under the endocardium located is the atrioventricular node. Convey impulses from the internodal tract to the ventricle. From this, first the atria are stimulated, then through this atrioventricular node, the impulse is transmitted towards the ventricle. Here you see the location of the AV node, and the delay is 0.1 second delay here occurs. 3 main functions of this AV node. It's like a gatekeeper. The impulse coming from the SA node through the internodal pathway, it acts like a gatekeeper. First, it slows down the conduction to allow the time for the atria to contract and empty its contact atrial cake before the ventricle contract. Secondary pacemaker, if SA node stops functioning due to some disease process, then the pacemaker function is taken over by the AV node. So the ventricles, they can be kept under control at the rate of 40 to 60 beats per minute. 40 to 59 means 60 beats per minute. Then AV node acts like a pacemaker. The atria will be not be controlled, but it controls the ventricles, contraction of the ventricles, which will be regular at the rate of 40 to 60 beats per minute. It will also block some of the impulses which are from being conducted to the ventricles when the atrial rate is rapid. Means if the atrial rate is up more than 150 per minute, then not all the impulses are transmitted from the atria to the ventricles, but it will transmit certain amount of impulses from the atria to the ventricle. Not all the impulses will be transmitted. So it blocks some of the impulses from being conducted to the ventricles when the atrial rate is not under control, it is rapid. That is called atrial flutter, atrial fibrillation. In those conditions, the atrial rate is very much high, and but not all the impulses are transmitted. So here we see the AV node, then the bundle of phase, then the bundle branch blocks. Bundle branches left and right. Left one is bigger than the right one, and then at the end there will be the Purkinje fibers. Now, atrioventricular is smaller collection of nodal tissue than SA node. It is located in the posterior inferior region of interatrial septum, near the opening of the coronary sinus. So if we go back here, here will be the opening of coronary sinus. We will see in the next diagram also. The signal generated by the SA node passes through the wall of the right atrium, propagated by the cardiac muscle myogenic conduction, which transmits signal rapidly from the SA node to the AV node. The AV node then distributes the signal to the ventricle through the AV bundle. Sympathetic stimulation speeds up the conduction and parasympathetic will slow it down. The AV bundle only bridge between the atria and ventricle that passes from the AV node through the fibrous skeleton of the heart, because fibrous skeleton of the heart act like an insulator between the atria and ventricle. Is the only pathway is the AV node and AV bundle, and that AV bundle runs along the membranous part of interventricular septum. So here we see is the SA node and then internodal pathway and then the AV node, and then the bundle of hairs and then the bundle branches. So here is the opening of the coronary sinus into the right atrium, and then here is the AV node. So AV node location also determined. Here in this diagram also you see the opening of the coronary sinus, and then the location of atrioventricular node. So to locate the atrioventricular node, here is a Cox triangle, the site of AV node, that can be determined by Cox triangle, showing the site of AV node. So here we can see the Cox triangle. This is a tendon of Todaro, and this is a fast AV nodal pathway. And then here is the opening of the coronary sinus, and here below is the tricuspid valve annulus, and there is slow AV nodal pathway. In this triangle, at the apex of this triangle is the AV node. This triangle is called as Cox triangle. From here we can very well locate the AV node and avoid the damage, or we can block the AV node for certain disease process. Blood supply of the AV node. The AV nodal artery is again through the right coronary artery in 90% of the cases, but in 10% of the cases is the left circumflex artery which supplies the AV node. The bundle of hairs, both the AV nodal artery and branches from the left anterior descending artery supply the bundle of hairs. Left bundle has a rich blood supply from the AV node, from the posterior descending artery, from the left anterior descending artery. So left bundle has a rich supply from three sources. Then we see here, we see the blood supply. This is the AV node. This is in 90% of cases supplied by the right coronary artery through the AV nodal branch of the right coronary artery. But it can also be supplied by the circumflex. There is a circumflex which will come back and will supply the AV node in 10% of the cases. But here you see the left bundle branch. It will be supplied by the left anterior descending from the posterior interventricular artery and from the left anterior descending artery and from the right coronary artery. So rich blood supply of the left bundle branch. This diagram should be drawn by the students. It will fulfill the both purposes of the coronary artery circulation as well as the blood supply to the conducting system of the heart. So when we see the conductive system from the right side, it looks like that, showing the AV bundle. Here is the opening of the coronary sinus. Here will be the area of the Cox triangle, and here is the right atrium and here is the SA node just at the entry of superior vena cava into the right atrium, and here will be the upper part of the sulcus terminalis, and then here is the branches, we see from the left side the left bundle branch, which is bigger than the right bundle branch because it supplies most of the interventricular septum also. So that is the left branch is more bigger than the right bundle branch. Now, the summary. If we summarize the conducting system of the heart, or impulse generation and conduction, SA node initiate impulse at the rate of 7 to 80 per minute, rapidly conducting cardiac muscles, tendon of Torado we have seen, rapidly conducting muscle fibers in the atria, causing them to contract. Then the impulse spread by, which is rapidly transmitted the impulse from SA node to the AV node. Then the signals, they are distributed from the AV node through the atrioventricular bundle, its branches, which passes on each side of the interventricular septum, supply the subendocardial branches of the papillary muscles and wall of the ventricle, which start from the apex and then spread superiorly from the apex upwards. So the extrinsic nerve supply of the heart is independent, has its own conductive system, but this conductive system is stimulated externally by the autonomic nervous system, and it is innervated by the autonomic nervous system, that is sympathetic and parasympathetic, through the cardiac plexus, which is situated below the arch of aorta. The sympathetic will come from the cervical and upper thoracic portion, while the parasympathetic comes from the vagus nerve. Sympathetic fibers, they terminate on SA and AV node and cardiac muscles and coronary arteries. These will result in cardiac acceleration, increased contraction of the cardiac muscles, and dilatation of the coronary arteries. So these three are the function of sympathetic fibers. Parasympathetic, that terminates on the SA and AV node and also on the coronary artery, but it produces reduction in heart rate, force of contraction of the heart is reduced, and there is constriction of the coronary arteries, opposite to the function of the sympathetic system. The parasympathetic system has opposite function than the sympathetic system. The cardiac plexus are two, superficial one and deep one, and they are situated below the arch of aorta in front of the right pulmonary artery. It is formed by the superior cardiac branch from the superior cervical ganglion of the left side of the sympathetic chain, and cardiac branches from the inferior cervical ganglion of the left vagus nerve, and give branches to the deep cardiac muscles, right coronary artery and left anterior pulmonary plexus. Here is shown the superficial plexus, then superficial cardiac plexus below the arch of aorta, and we have understood where it is forming. And then there is a deep cardiac plexus. It will supply the left system as well as the right system, and the branches will be same from the sympathetic and parasympathetic. Sympathetic from the superior inferior cervical ganglion and satellite ganglion, and the parasympathetic coming from the vagus nerve. So surround the coronary plexus, they surround the coronary artery, and their branches receives branches from the cardiac plexus and right coronary plexus, then the left coronary plexus. The fiber sympathetic will be effect on the heart rate, and coronary arteries parasympathetic, they will also decrease the heart rate and cause vasoconstriction. So extrinsic nerve supply comes from the medulla, is a center, and that activates the sympathetic neuron that increases the heart rate. Cardioaccelerator center. There is also cardioinhibitory center that activates the parasympathetic, and decrease the heart rate. So both are located in the medulla. One is the cardio accelerator and other is the cardio inhibitory. Cardiac center receives input from the higher center, that is the hypothalamus, and also monitoring the blood pressure and the gases concentration. So it's in this way it is effective in increasing. Now will be the blood supply. We will discuss in the next lecture about the blood supply of the heart. So we have understood about the conduction system of the heart. Now next lecture we will see the blood supply of the heart. Allah Hafiz.